symphysis and SI joint pain can be excruciating during pregnancy. I had this myself and it was not fun. There was a point where every step I feel like my hips were just coming apart. Now remember, that can't happen. Our hips are pretty solid joints, but there are pieces of cartilage in there that connect both our pelvic bones together and connect your pelvic bones to your lower spine, and that cartilage does allow for some movement. Especially when you're further on in pregnancy and you have all these hormones rushing through your body to help soften and loosen everything so that that baby can eventually come out. This can cause a lot of shearing and a lot of pain with different movements. Today we're going to talk about things that you should avoid and exercises that you can do to try to improve this during pregnancy. So when it comes to exercises to avoid if you're having SI joint or pubic symphysis pain during pregnancy, as soon as any of my clients say that they are having this pain, we lay off all single leg exercises. So whether that be lunges, doing things standing on one leg, stepping up onto a box, these are all things that can really cause shearing through the hip bone. So that can cause one hip bone to go forward as the other one goes back, just cranking into that SI or pubic symphysis joint, which is not pleasant. And there's many other things that we can do instead that's going to keep it from getting worse and allow you to still work out without being in pain. Now remember, doing things seated is always best. If you're having severe hip pain during pregnancy, try doing your exercises sitting down. So whether you be doing a shoulder press or maybe some bicep curls, there is no reason that you need to be doing this in standing. Do it in sitting. You're going to have stability through your hip bones and it's likely not going to cause you any pain. Another thing that you can do during pregnancy is to help work on your glutes. So remember, our glute muscles are what supports our pelvic bone. So that's what's going to be really important to keep strong during pregnancy. I find for a lot of people, the glutes completely turn off. It has a little bit to do with posture and just other things. You're not as active during pregnancy. It's harder to use your glutes to create movement because you're lifting the baby weight on the front. So by being really aware of this and working in glute and adductor exercises, so our inner thighs, that can help stabilize through the pelvic bones. Now I do find that some people have a very hard time doing adductor exercises because that also flares up that pubic symphysis pain. And if that's the case, just don't do those either. We can work on the outer glutes and that should be just fine. Now the other thing I want you to remember